Hi, my name is John Pilcher. I'm a bariatric surgeon. It's No Shave November, and this video is going to be about strength and endurance after bariatric surgery. And it's really common for people to look at the operation and to know that they're going to take in less calories and less protein and ask the question, okay, am I still going to be able to be strong? Am I going to be able to have endurance? Am I going to be able to work out after I have this sleeve or this gastric bypass? And the answer is absolutely yes. The key thing to understand, which is outlined in detail in other videos of mine, is that the surgery is not mainly working through a restrictive mechanism. The surgery is not physically stopping you from eating. The surgery is mainly changing your appetite level. And to understand this a little bit further, I'd like to divide the body weight control into sort of two systems. There's a fat control system and a nutrition protein control system. And the sleeve and the gastric bypass, they do affect the fat control system, bringing it down to a lower healthy level, but they do not affect the nutrition system, so that when a patient's body senses that it needs nutrition and calories, it will give a person hunger. And the advice that I give to my patients is that if you feel hungry, well, eat something healthy, and if you don't feel hungry, then you do not have to eat, and then you lose more weight in that way. And so as we translate this to an exercise phenomenon, one sort of commonly accepted wisdom or established practice that I like to speak against a little bit is the idea of loading up with lots of protein or carb loading or calorie loading before exercise to boost the effects of the exercise. I think that actually tends to be counterproductive. It's a little bit of a misunderstanding. You don't get more muscle mass through eating more protein. It's different. You get more muscle mass by exercising the muscles. And so the way I would like for patients to come at this is to do exercise and to start very early after surgery, within a week or two. And there again, I've got a video about exercise and recovery after bariatric surgery, but start early. Do exercise, work the big muscles, the thighs, the buttocks, the core, work these muscles, and that will lead to a little bit more hunger, and more hunger will lead naturally into more eating in a healthy way. The practical experience is that people who are big, especially guys, can just make stuff move. And there's a lot that's challenging or bad about being obese, but being able to move stuff around without having to think about it too much is kind of a cool thing. And there's an appropriate concern about losing that as the weight comes down. And in fact, during the first 3 or 6 months, when the weight loss is rapid and there's very rapid fat burning, there is some reduction of muscle mass as well, a little bit of muscle burning. And so no matter what you do, to be honest, you're going to get a little weaker temporarily. And I don't want you to worry about that, because what I want you to do again is I want you to start off exercising, especially strength exercises, very early after your operation. And it is practical to rebuild that muscle, and actually speaking about the earlier times, to preserve the muscle during that first month or two with a very little eating. And by the way, I said just a minute ago that you can eat as much as your body needs. That's not totally true in the first month or two, because the surgery, as it heals, is very restrictive, or we might say sensitive or resistant. But what I'm saying here is completely true at 3 months and 6 months and beyond. In fact, I've got a number of patients who are very successful in athletics after their operation. I like to think in particular of one of my patients from about 2004 who has become a serious recreational cyclist. And Mark, shout out to you if you're watching this. But this gentleman has become a long-distance cyclist, cycling 200, 250 miles a week. And Mark keeps a normal food plan with about 2,500 calories a day because he burns that much, and he has an excellent weight maintenance, and he still comes to see me every year, so we know this is a fact by measurement and by direct personal experience. I have a lot of patients who are in other physical activities like Krav Maga, full-on strength training, active duty military, and fully capable of performing those jobs. Also think about police officer, firefighter. I have people in those professions as well. Fully successful, complete strength, complete endurance after their bariatric operation. In closing, I want to circle back to some cautionary notes about some commonly accepted wisdom around protein and calorie intake. if you train in a gym or you train with a trainer, you're going to get lots of advice to take extra protein supplements and the powders that you mix with water that give you energy, and they're exercise boosters. And I just want you to be very cautious with those because most of them have a lot of chemicals and stimulants in addition to some proteins. And even the protein aspect, the amino acids, are processed. They have chemicals in them. And what I would rather for you is that you have natural food. And if you want to have some nuts before a workout, some salami, some cheese, or after a workout, I've got no problem at all with that. I think you're going to have enough hunger to make that be a natural process or a natural behavior. And I want to strongly encourage you not to go for the artificial sort of the booster supplements. So in summary, by all means, please do work out. Start early. Start 1 week after surgery, and that will give you the best physical strength outcomes as well as the best lasting weight outcomes.